We like knowing that doctors are there for us and they can help us get to be healthier and also fix what's going on inside our bodies. I'm a patient as well. Even though I'm a doctor, I still have to go see my regular doctor to make sure everything's in tip-top shape so I can give you the best videos that are out there. And I like knowing that my doctor and me are on the same side. And I want my doctor to do whatever it takes to get me to be happy and healthy. But as a patient, have we ever wondered, are there things that our doctor wants us to do to make sure we can be happy and healthy as well? I know that when I'm in my doctor role, there are certain things that I want my patients to do and implement to make sure they can do the best thing to make me help them out. In fact, I'm gonna tell you a little secret here. Shh, don't tell anybody. The doctors have a list of things that they wish every single patient would do as well. And if you did this list, you're going to be on the road to recovery, and you can allow me as a doctor to help you out as a patient. Now you may be saying, hey, I never thought about that. You mean I have to have some sort of relationship with my physician to make sure we get the best care? Yes, that is absolutely correct. The patient-physician relationship is sacred, but it is a relationship. It is a two-way street. It's not me just telling you what to do and you not doing anything. You as a patient and me as a patient, we also have responsibilities to make sure we can get our own health in our own hands and to allow us to have the healthcare professionals lead us on the right track. Howdy y'all, Dr. Islam here, aka your gut health guru, trying to give you the best tips and tricks so you can live your best life from the top all the way down to the bottom. And keep watching, because I'm going to give you 5 things I wish every single patient would do to allow me as a doctor to allow my patients to get them in their best health that they can get. Imagine yourself helping your doctor to help you get better. Guys, let's talk about food. Now it's Captain Obvious to say that every single doctor wants to help out their patients. I certainly do as a GI doctor. I know all my friends in the medical field feel the exact same way. We want to do the best that we can to make sure you don't see us every single day. I love seeing my patients, but I don't want to see you every single week in the clinic because that means that I did something wrong and not getting you better and feeling to your optimal health. And I know that if I see my patients once every 3 or 4 or 5 months, I'm doing my job as a doctor, keeping you away from my office, keeping you away from sickness and illness, and keeping you happy and healthy. That's what I want. I love you guys, I really do, but I don't want you to be in my office all the time because that means you're not getting better. And that doctor-patient relationship is exactly that. It is a relationship. It's a two-way street. Well, I help you, but you also help me as well. Yes, you gotta help me. Help me! Help you. Help me. Help you. Help me. Help you. Here are 5 things I want you guys to do as patients to allow us doctors to get the best relationship for you and to get you feeling better. Number 1, develop a continuity with them. There are patients I've taken care of for over 10 years. I know everything about them. Yes, everything, yes. I know their medical history, their social history, what medications they've been on, everything that involves their healthcare. I know intimately because they've had continuity with care with me for such a long time. That relationship, that continuity of care is incredibly important because it allows me to develop a relationship with you, but not only that, I know what you've been through in your past. I know what we tried, what hasn't worked, and what has worked, and what we can do to adjust things to hopefully allow you to have a better and healthier life. And it's these small nuances from a long history that allow me to better take care of you as a person as opposed to you as a patient. And that is the relationship that us doctors want to have. We want to think of you as an actual person who we love, we cherish, we've known for a long time, as opposed to just a patient coming through the door. Number 2, ask questions. Guys, I know you're shy when you ask questions. When I go to the doctor, I freeze up as well. It's like, oh my gosh, What's going on? I'm in this field and I'm freezing up, but I want you to ask me questions. I crave those questions because I know by you asking me questions, I can clarify any misconceptions, any confusion. If I'm speaking in medical talk, I can hopefully simplify those terms as well. Too often I go into my doctor role, and other doctors do this as well, where we start speaking all this medical jargon, and sometimes it goes way over people's heads, and I don't realize that I'm doing it. If you ask me questions, help me clarify what's going on, this allows me to make sure you understand the treatment plan to get you taken care of. And I don't want you to leave your appointment with that anxiety of having those unanswered questions and realizing that you did not have the opportunity to speak to us in that room. Number 3, take your medications and follow instructions. Oh my goodness, this is such a big pet peeve of mine. If I give you medication for 7 days and you take it for 3 days, you're like, oh, I feel great now. I'm gonna stop the rest of this, not a big deal. No, I don't want that. There is a reason I prescribed it for 7 days. So even if you feel great, everything's gotten better, I want you to take the medication at the right time, for the right period, at the right dose. So for example, antibiotics, most common thing that we give for a lot of people, and more often than not, patients will stop taking it as soon as they feel better. No, there's a reason we want to give it to you for 5, 7, or 10 days. Number 1, it's the treatment guidelines. Number 2, helps to make sure you don't develop an immunity to the antibiotic. And number 3, it's going to ensure that infection that we're treating is completely gone away. When I give you medication, and I give it for a reason, I know I'm gonna give it to you for a reason because it's going to work. But if you don't take it, and you don't take it correctly, how am I supposed to know? Is it because you have a really bad infection, or you just didn't take the medication appropriately? It gets so confusing, and I don't want that confusion to get in the way of your healthcare needs. Number 4, use the internet to inform, but not diagnose. Alright guys, come on. I know I'm talking to y'all. I know it. You guys are Dr. Googling everything, seeing what's going on. Oh my gosh, you see all these things. You're like, oh my goodness, I'm going to die. No. The internet is a fascinating thing. I'm using this right now to obviously show this video, but it can be a double-edged sword. Too much information without the right context and knowledge can be scary, anxiety driving, and really dangerous for individuals who don't have the right context for that. Use the internet to kind of get information about what's going on so you can ask informed questions, but don't do this as a way to diagnose, treat, or to tell me what to do. The internet gives you data, but not discernment. And it's that discernment that's important for us to know as clinicians to allow you to get the best care based on evidence that what you need. It is that discernment that years and years of training, going through research papers, reading articles, going through trial and error, studying from other people who are in the field of what's going on. This gives me the collection of information I need to make sure I can take care of you properly without randomly Googling something on the internet and some crazy person putting something on there that is completely false and not true. Number 5, plan ahead. Yes, sometimes the doctor's visit has to be short notice. You have to go because you have a cold, you have an appendicitis. No one can predict these things. But more often than not, we have these appointments scheduled months ahead of time. If you know an appointment's coming up, write down the questions you want us to answer. If we're checking up on symptoms, keep track of those. How are you feeling? Does the treatment options we give you, did it help? If it did help, how did it help? How did it not help? Did you take the medications that we prescribed? Why or why not? This is information that I need to know if we're making the right progress for what is going on. Oh, and those random questions that pop up in your head, write them down. Put them on your iPhone. Just use the Notes app. Make sure you have that information down so you can have that information to discuss with me in your next visit. The best thing I love is having a prepared patient. I love it when patients pull out their phone, have those lists of questions so I can answer them to see exactly what I can do to help out with their care. So here's what I want you to do today. I want you to do a self-evaluation on your health status. The good, the bad, and the ugly. Write it down. Make a list of what is going well, what you're concerned about, and what questions you have for me. Bring that list to me so we can have that information, so so I can give you the best options for your treatment and answer any questions you guys may have. So my question today for you, would you add anything? Would you change anything? Have you had this type of experience in the healthcare field? Comment down below. I would love to hear what you guys have to say. Guys, well, thank you for watching. If you haven't already, don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to my newsletter where you get great tips and tricks from yours truly coming to your inbox every single week. Guys, well, thank you for watching. Don't forget, let's talk about poop. Thanks, everybody.